This video will answer all of your questions about depression. Depression is a mood disorder that affects a large portion of society directly or indirectly through family and relatives. It is characterized by negative feelings such as a state of reluctance that lasts for weeks or months, an inability to enjoy life, a gradual decrease in self-confidence, and intense hopelessness. Guilt, worthlessness, and helplessness are common symptoms of depression. Depression symptoms differ from person to person. The most common symptoms, however, are sad, anxious, or empty feelings that last almost every day for weeks or months. Pessimism, hopelessness, and mood. People who are depressed express that they do not enjoy their usual activities and that they lack the energy to meet their daily and necessary needs such as dressing and eating. Family and friends frequently notice the person's change, but they have no idea how to assist. Without treatment, especially in severe forms of depression such as major depression, serious problems can arise. Untreated depression can lead to potentially fatal conditions like alcohol and drug addiction. It can erode people's relationships with their surroundings, cause problems at work, and cause more damage over time. Clinical depression, also known as major depression, is a serious mental illness that affects a person's body, thoughts, and emotions all at once. It is impossible for depressed people to escape their situation in an instant. Clinical depression can last for months or even years if it is not treated with psychotherapy and antidepressants. This disorder, which can result in interesting situations, also contains intriguing facts. What are the root causes of depression? Depression manifests itself in a variety of situations. These are the causes. The individual's socio-economic circumstances are unfavorable. Use of drugs and alcohol. Unemployment. Divorce, loss of a family member. Separate living arrangements. Anxiety problems. Previous depression history. Personality types. Stress. Changes in hormones. Being sexually or physically abused, particularly as a child. Some medications, medical conditions. These factors are also known as depression risk factors. What are the signs and symptoms of depression? Although we say, "I am depressed," right away when we feel depressed in our daily lives or when we encounter a situation that bothers us, depression is a highly complex mood disorder that combines psychological, biological, and social factors, the symptoms of which vary from person to person. While the symptoms of severe depression differ from person to person, the following are the most common: hopelessness, worthlessness, and helplessness. Inability to regulate emotions. Loss of interest in daily activities. Appetite significantly increases, decreases. Significant weight gain, loss, significant changes in sleep patterns. Significant irritability and anger. Significant energy loss. Increased inattentive behavior due to self-hatred and severe guilt. Problem concentration. Unknown source of physical pain. While some people describe depression as a deep sense of emptiness, others describe it as an empty numbness disconnected from life. Depression symptoms, particularly in men, can manifest as severe bouts of rage and restlessness, whereas in women, they can manifest as intense numbness and an inability to enjoy life. What are the signs of female depression? Women's depression symptoms are typically increased weight and appetite, particularly a preference for carbohydrate-based nutrition, increased sleep requirement, intense feelings of guilt. It shows up as seasonal depression. What are the signs of male depression? Depression symptoms in men in general. Working long days. Distancing from family and friends, who make up one's close environment. Use of drugs. Increased proclivity for violence and tantrums. It is characterized by an increase in risky behavior such as infidelity. What are the signs of depression in teenagers? Depression in young people frequently manifests as restlessness, anger, and agitation rather than bouts of sadness. Depressed young people may also experience unidentified physical pain, such as headaches and abdominal pain. What are the signs of elderly depression? Physical symptoms such as unexplained pain in the body and memory loss, rather than emotional symptoms, characterize depression in the elderly. Furthermore, symptoms such as neglecting personal care and failing to take medications that should be taken can be interpreted as signs of depression in the elderly. Depression and sobbing fits. Although crying is not a formal diagnostic criterion for depression, many depressed people report crying episodes. If you find yourself crying more than usual, it is worth investigating whether you are also experiencing other symptoms of depression. Sexuality and depression. It is quite common for people diagnosed with depression to have sexual problems. Depression can cause problems such as inability to orgasm and erection problems. However, with the right treatment, such sexual issues can be easily resolved. The desire for sexuality begins in the brain, and the commands that need to reach our body's sexual organs are transmitted via neurotransmitters. The primary cause of problems like sexual reluctance in depression and other mood disorders is that the parts of the brain that communicate via these neurotransmitters do not function properly. As a result, many men and women suffering from depression report having less or no sexual desire. As you can see, depression has a wide range of symptoms and manifestations. What are the different types of depression? Depression manifests itself in a variety of ways. However, the most common types can be divided into two groups. Clinical depression, also known as major depressive disorder, and dysthymic disorder are two of them. Depression is classified as mild, moderate, or severe based on its severity. It is critical to correctly identify the type of depression experienced in order for the treatment process to proceed smoothly. What exactly is major depression? Major depressive disorder is another name for clinical depression. It is also the most severe form of depression. It is characterized by intense negative emotions such as persistent sadness, hopelessness, and a sense of worthlessness, and it is not recoverable on its own. Major depression symptoms. A person must meet 5 or more of the following criteria over a 2-week period to be diagnosed with clinical depression. Feeling down most of the day, loss of interest in daily activities. Weight gain or loss that is significant. Insomnia or an inability to wake up. Thought and movement slowing. Most of the day, I was exhausted, tired. Difficulties concentrating and making decisions. Suicidal or death thoughts on a regular basis. What exactly is major depression with melancholic overtones? People who suffer from major depression with melancholic features lose interest in almost any activity they previously enjoyed. However, to be diagnosed with major depressive disorder, a person must exhibit at least 3 of the following symptoms. Loss of enjoyment in most, all activities. Inaction in the face of positive events. Psychomotor behavior differentiation. Extreme guilt. Insomnia. Morning depression has become more prevalent. Major depressive disorder with distinctive characteristics. Certain behavioral patterns characterize atypical depressive disorder, which is classified as a major depressive disorder. People suffering from atypical depression's emotional state changes dramatically in response to external stimuli. They may feel extreme joy when they receive good news and extreme sadness when they receive bad news. Atypical depression usually appears for the first time during adolescence, and it continues into adulthood. Atypical depression symptoms include the following. Weight gain that is significant. Significant appetite increase. Extreme drowsiness. Heavy feeling in the arms and legs. Rejection sensitivity. This depression is regarded as one of the most dangerous. Smiling depression is another name for atypical depression. More information can be found in our article Smiling Depression. Depression after childbirth. Postpartum depression is a type of major depression that occurs during pregnancy or within 4 weeks of childbirth. The precise cause of postpartum depression, which affects 10 to 15% of women who give birth, is unknown. Severe sadness, constant crying, intense anxiety, and hopelessness are common symptoms of postpartum depression in women. Seasonal affective disorder, SAD, is a type of seasonal depression. Seasonal mood disorder is distinct from other types of depression in that it occurs only during specific seasons. Seasonal affective disorder affects 1 to 2% of the population, particularly during the winter months when daylight hours are reduced. However, it is more common in women and young people. Seasonal affective disorder patients appear completely different in the winter than they do in the summer. Seasonal affective disorder, which typically manifests as hopelessness, sadness, stress, and apathy, begins in the fall-winter months and lasts until the days lengthen in the spring-summer months. Major depression with psychotic features. Major depression with psychotic features is a major depressive disorder characterized by hallucinations and delusions. People suffering from major depression with psychotic features may report hearing voices telling them they are worthless and do not deserve to live. Major depression with catatonic features. Psychomotor behavior is severely impaired in people suffering from major depression with catatonic features. At least 2 of the following symptoms characterize depression with catatonic features. Immobility of the muscles. Muscle movements with no apparent cause. Extreme negativity or silence, unusual body position. Repetition of others' words and actions. Dysthymic syndrome. Dysthymia is a mild but persistent type of depression. Symptoms typically last at least 2 years. Dysthymic disorder has a more negative impact on an individual's life than clinical depression. This is due to the fact that its symptoms appear over a longer period of time. Dysthymic disorder is characterized by symptoms such as decreased interest in daily activities, feelings of hopelessness, decreased productivity, and low self-esteem. People with dysthymic disorder are frequently described as critical, constantly complaining, and unable to enjoy life by those around them. How can depression be treated? According to recent research, depression is a highly treatable disorder. Antidepressants and psychotherapy are the most commonly used treatments for moderate to severe depression today. In most cases, depression treatments that combine both methods have a higher success rate. According to recent research in this field, talk therapies are the most effective treatment method, particularly in milder forms of depression. Cognitive behavioral therapy applications, in particular, are among the most effective treatment methods for assisting depressed people in changing the way they think that leads to depression and creating positive cognition patterns. Psychotherapy, talk therapy, talk therapy. Psychotherapy is the most commonly used treatment for mild to moderate depression. Psychotherapy is typically administered in 1 to 2 hour sessions per week for a period of 12 to 20 weeks. We can examine the most commonly used methods in psychotherapy under the following headings. Cognitive behavioral therapy, CBT, is a brief therapy aimed at identifying and eliminating irrational thought patterns. Interpersonal therapy is based on the idea that the relationships people form with their surroundings have a significant impact on their psychological health. The psychotherapist in interpersonal therapy attempts to assist the depressed individual in changing their thought and behavior patterns and improving their external relationships. Psychodynamic therapy is a type of long-term psychotherapy that seeks to uncover the underlying, unexplored causes of depression. EMDR, eye movement desensitization and reprocessing, a type of psychotherapy aimed at revealing traumatic memories. Depression medication and antidepressant use. Antidepressants are the most preferred method for the treatment of moderate to severe depression. The duration of action of antidepressant medication usually varies between 2 to 4 weeks. One of the most serious issues with antidepressants is that people stop taking them after only a few days because they do not work. As a result, if your doctor prescribes medication to treat depression, it is critical that you take it for the recommended duration. Is there a link between antidepressant use and sexual reluctance? Although antidepressants are an effective and necessary tool when prescribed by a doctor for mood disorders such as depression, some antidepressants, particularly selective serotonin reuptake inhibitors, SSRIs, can cause unwanted side effects. Antidepressants help depressed people improve their mood by altering the structure of brain chemicals known as neurotransmitters. The same chemicals are involved in our sexual needs. As a result, antidepressants are known to cause sexual problems by affecting the nerve pathways responsible for transmitting messages about sexuality in our bodies. Complaints about sexual problems may increase as the medication dose is increased. What are the possible sexual side effects of antidepressant use? The following are some of the sexual problems associated with antidepressant use. Sexual apprehension, late ejaculation or erectile dysfunction, inability to initiate sexual contact, inability to enjoy orgasm. Other alternative methods used to treat depression include meditation, yoga, nutritional supplements, exercise and massage therapy. How long does depression treatment take? Depression is a highly treatable but difficult condition that requires individualized treatment. One of the most important aspects of success in this process is for the depressed individual to be informed about all treatment options and to choose the best one for him, her. Psychotherapy and lifestyle changes are the most commonly used treatments for depression. Antidepressants may be used in severe cases of depression. The method of treatment chosen is determined by the individual and the severity of the symptoms. How long does treatment for major depression take? The vast majority of depression cases benefit from well-established treatment options. Major depression can last for more than 2 years if left untreated. As a result, treatment should not be overlooked. It would be beneficial to seek immediate assistance from a specialized psychologist. With the right treatment, the duration of treatment for major depression can be reduced to a few months. What happens if you don't treat your depression? Clinical depression, also known as major depression, affects an individual's body, thoughts, and emotions all at once. If such severe forms of depression are not treated, they can lead to serious complications. Neglected depression can lead to potentially fatal conditions like alcohol and drug addiction. It can also deteriorate a person's relationships with others and cause problems at work. On the other hand, it has the potential to cause more damage over time. It is not possible for depressed people to overcome their depression in an instant. Clinical depression can last for months or even years if it is not treated with psychotherapy and antidepressants. Depression is a disorder that makes many people's lives difficult and causes them to put shackles on their feet. In this case, however, the solution is entirely in your hands. Frequently asked depression questions. Can depression cause hallucinations? The symptoms of depression can be accompanied by the delusional thoughts of psychosis in psychotic depression, a type of depression. People with this disorder are generally detached from reality because it causes hallucinations and delusions. What is depression with psychotic characteristics? This psychiatric syndrome, also known as psychomotor agitation or retardation, is characterized by severe symptoms such as impaired cognitive functioning and confusion. Is it possible to treat psychotic depression? Yes, it is treatable. Electroconvulsive therapy, ECT, is a successful treatment for psychotic depression. However, there is a significant risk of relapse following treatment. What exactly is severe depression? Although severe depression is a serious mental illness, it is treatable. It is distinguished by mental, physical, and emotional manifestations. The inability to enjoy life and a negative mood are the most distinguishing characteristics. What exactly is major depressive disorder, MDD? It is a mental illness characterized by a persistently low mood for at least 2 weeks. It is also known as depression. How do you spot major depression? For at least 2 weeks, this condition is characterized by low mood, involuntary weight loss or gain, loss of appetite, poor sleep quality, and energy loss. Is it possible to die from depression? This disorder has an impact on every aspect of a person's life. It is extremely incapacitating. Above all, it has been identified as one of the leading causes of suicide. As a result, it has the potential to cause death indirectly, if not directly.